Okay, so let's take a look at the lower triangle. We are going to do 3 views here. We are first starting in the right upper quadrant, have a look at the liver and the kidney. We are then going to move to the left side of the patient, have a look at the spleen and the left kidney, and then we're going to move into the suprapubic area and have a look at the urinary bladder. So you take a transducer, you put some gel on it. If your patient is able to, you can ask him to put their hands above their head. Thank you. Marker is pointing cranially, and we can start to image here. And we look for the liver and the kidney. We can see the kidney very nicely here. We can see it sliding when the patient is breathing, and we can see the interface between the liver and the kidney. We can see there is no free fluid in here. Once we've verified that, we can slide the transducer up a little bit so we can see the diaphragm better. And when the patient inhales, there it is, we can see the curtain phenomenon. When he exhales, we can see the liver coming back into view. We are going to go to the left side now. We will look at the collar pouch. We need to go quite dorsally here because the spleen is always more dorsal and more cranial than you think. The marker is again pointing to the patient's head, and we can see both the kidney and the spleen here. We're going to fan through the collar pouch a little bit and verify that there really is no free fluid. And again, we're going to slide up a few centimeters so we can see the diaphragm. And when the patient inhales, we can see the curtain coming over our screen. Very nicely seen here. And for the third view, we are going to point the marker to the patient's right, place it between his belly button and his pubic bone, and tilt it downwards so we can get the urinary bladder. There it is. You can see the dark shape. There's no free fluid behind the bladder, but there is fluid within the bladder, which is good because it makes for better images. You can also fan through here. And just like that, we verified that there is no free fluid.